Welcome to Health Discoveries, the definitive location for the latest in health breakthroughs. My name is Todd Bates, and today we're going to be talking about heart disease, the #1 killer of people in the world. In fact, over 1 million people die each year due to heart disease. Over 500,000 women die each year from heart disease. In fact, every 60 seconds, someone dies of a heart attack. Today, to talk to us about heart disease is Dr. Sandra Denton. She graduated from the University of Tennessee Medical School. She worked as an emergency room doctor for 13 years. Today, she's the founder of the Alaska Alternative Medicine Clinic in Anchorage, Alaska. She has 26 years plus experience in the effective use of vitamins, minerals, and other natural remedies, including chronic medical conditions. She's board certified in chelation therapy and the diagnosis and treatment of toxic metal poisoning. Welcome, Dr. Denton.
Well, thank you, Todd. It's good to be here. Sudden cardiac death accounts for 300,000 deaths each year. And I used to teach my emergency room doctors that the first symptom of heart disease in 50% of the people is sudden death. And 95% of these folks die before they ever reach the hospital, so there's little that we can do for them. And that's disconcerting.
It is. And it's not just overweight people or people that we would normally think are at risk for heart disease, but over 100,000 athletes die each year from sudden cardiac death.
That's right. It's not unusual to open up the sports page of the newspaper and there's the name of some well-recognized athlete in good physical condition, healthy by all of our standards, and yet gone overnight because of heart disease. Todd, this is even beginning to affect our young people. 60% of youth are at risk for heart disease, to the point that doctors and pediatricians are now prescribing medications to 8-year-old kids to control their blood pressure and their cholesterol levels. We have no idea what the long-term effects of these medications are going to be, and I would like people to know that there's another answer.
Yeah, I think a lot of people don't realize that heart attacks kill more people than the next 9 causes of death combined.
That was a surprise to me, and most women are afraid of breast cancer, but they don't realize that 1 in 3 of us will likely die of heart disease.
So where does the problem start?
It starts in the inner lining of our blood vessels, the endothelium. A healthy blood vessel, the inner lining of that blood vessel is smooth like a Teflon pan, and so that blood can flow through unobstructed. But in an unhealthy or diseased endothelium, it's more like Velcro, and it causes the white blood cells and everything passing through it to begin to accumulate and form plaque, which eventually leads to obstruction, stopping the blood flow, leading to a heart attack or even a stroke.
Let's talk a little bit about the Nobel Prize.
The Nobel Prize was awarded in 1998 to 3 Americans for the discovery that the body uses nitric oxide to make the blood vessels relax and widen, and they felt like this was going to have major implications in heart disease.
So it's just a matter of getting nitric oxide into the body. So what is nitric oxide?
Nitric oxide's been called the molecule of the year by Science magazine. It's actually produced by the endothelial cell linings along the 100,000 miles of blood vessels and capillaries in our human body. And that nitric oxide keeps the blood vessels wide open, elastic, and functioning properly, instead of what we know as hardening of the arteries, where the arteries become stiff. The heart has to pump harder to keep the blood flowing. Every single organ in the body can have a positive impact by being exposed to nitric oxide, not just the heart. And there's several factors that deplete nitric oxide, such as aging, smoking, alcohol. Many medications actually deplete the body's nitric oxide.
Well, you really can't say much more than this. Right out of Dr. Cook's book, it says there's magic within all of us. It comes in the shape of a molecule known as nitric oxide, a substance so powerful that it can actually protect you from a heart attack. That's a pretty bold statement.
That's a bold statement by the head cardiologist at Stanford University. My favorite book, Todd, is No More Heart Disease, How Nitric Oxide Can Prevent and Even Reverse Heart Disease and Stroke. I think that's a message of hope for many of my patients, and it's written by one of those 3 Nobel Prize winners, Dr. Louis Ignarro.
I guess the question is, how do you get nitric oxide into your body?
Well, Todd, you can't just take nitric oxide. Your body needs the raw materials to actually make the nitric oxide. And that raw material is L-Arginine, a simple amino acid. And L-Arginine has been called the magic bullet for the cardiovascular system, and this was discussed in the book, The Arginine Solution. From the very cover of the book, it says, open clogs arteries, reduces risk of heart disease, boosts potency, it boosts your immune system and your muscle strength. So here are 3 different sources telling us that there's something that we can do to protect ourselves, be proactive in our health, and possibly prevent the heart disease. But the thing that gives hope to many of my patients who have already been diagnosed with these conditions is that they're not stuck in that situation. There are things that they can actually do to undo the adverse effects that they've gone through already.
I was amazed, Dr. Denton, to know that there's over 10,000 medically published clinical studies about L-Arginine and nitric oxide.
Absolutely. And these studies prove and show that L-Arginine lowers blood pressure, it lowers cholesterol and triglycerides, improves diabetes, improves sexual function, or it reduces blood clots and strokes, and it even improves people who've been diagnosed with heart failure.
So it can positively affect people with what kind of risk factors?
Folks who have already been diagnosed with elevated cholesterol or triglycerides, those are the fats in the blood. People who have been diagnosed with high blood pressure, those who've been diagnosed with diabetes, who are overweight, especially those people who have a family history of heart disease or stroke. Smokers are more prone to cardiovascular events. And the symptoms that we associate with many of the cardiovascular situations going on would be possibly chest pains, especially on exertion, leg pains that are keeping you from walking any great distance, that get relieved when you sit down and rest for a few minutes, but start up again when you start to walk, becoming easily winded when you're doing minimal activities, or just plain fatigue, especially in women. This is a sign that we've come to start looking harder for heart disease in women when they're complaining of unexplained fatigue.
So, Dr. Denton, I know you're a big proponent of liquid arginine as opposed to pills or powder. Why?
Well, the experts usually indicate that the dose needed of L-Arginine to get the benefits that we're looking for are a minimum of 5,000 milligrams to up to 10,000, even 15,000 milligrams of L-Arginine. And I want to point out, by the way, that L-Arginine needs to be accompanied by another amino acid, L-citrulline. It just simply enhances the effects of L-Arginine and helps to ensure that it gets inside the cells to do its job. But when I started telling patients to take this amount of L-Arginine, the only source available at that time was tablets or capsules. And the tablets and capsules were in 500 milligram doses. So people were having to take a minimum of 10 to 20 tablets a day in addition to their prescription medications and whatever nutritional supplements they were already taking. And Todd, people can only do that for so long. They can read this information and see what the benefits are, but it gets old swallowing all those tablets every single day. The physician desk reference says that pills may only be 20% absorbed. And it's not unusual for me to get an X-ray report that the radiologist has indicated seeing undigested tablets in the GI tract. So what are these pills doing us any good? Powder is certainly better than the tablets, but in my experience, as you finish the glass of powder, you look down at the bottom and there's this sediment in it, and who knows how much arginine is left in the glass. But truly, the best form that I found over the past several years was when I switched to a balanced liquid supplement, because 90% of the liquid is going to be easily absorbed, and people are much more compliant with taking that once or twice a day than they were 10 or 20 pills a day.
So what does a balanced liquid arginine product mean?
Well, I like to see that it has certainly the L-citrulline in it, and I have found benefit when there were omega-3 added to it, antioxidants, B vitamins, vitamin C, fulvic trace minerals. I think when you put all of these things together into a liquid, you're going to have synergy, and you're going to have just better enhanced effects of the L-Arginine itself. I probably have close to 300 patients or more. I've been using the liquid arginine products since about 2006. And Todd, the results have been absolutely amazing. It's one thing to read books and articles about something, but it's another thing to actually see it work in real-life people. Certainly something that I cannot say about any prescription medication that I'm familiar with. Some of these stories are absolutely incredible. One patient in particular had 6-vessel bypass 10 or 12 years ago. He was told that he needed to go to Seattle and have a catheterization done to look at the blood vessels again and possibly have further surgery, as it's well known that bypasses generally last 5 to 7 years, and then the procedure has to be repeated. When he went to Seattle, the doctors were absolutely amazed. 5 of the 6 blood vessels were wide open, and the 6th blood vessel was closed, but the body had built something called collateral circulation. It had made brand new blood vessels that bypassed the blockage and supplied plenty of blood to the rest of the heart, and the doctors did not have to replace the bypasses or put stents in or do anything else. This gentleman had been taking the liquid arginine product 2 to 3 times a day for the past 3 years, and he truly attributes it to saving his life. I have other patients that not only do they feel better, they have less colds and flu and things that we like hearing, but I'm one that I'm science-based. I like to see objective, hard data that somebody's really getting better. And I can certainly say that with the balanced arginine products, I have seen that. I have seen blood tests return to normal, the cholesterol, people be able to get off of their cholesterol drugs, minimize, reduce the dose, or even get off of their blood pressure pills. Another blood test that I'm very impressed with is an indicator of the risk of having a stroke. And if this blood test is elevated, you are about 5 to 7 times more likely to have a stroke within the next year than the average population. And Todd, most people are more fearful of a stroke than they are of a heart attack. They've seen enough television to know if they have a heart attack, they're either going to die on the spot or they get rushed to the ER and somebody places a stent and they live happily ever after, or so they think. But with a stroke, we all know somebody in our family who's been devastated by the effects of a stroke. When this blood test became available, I began to do it quite often in my patients, and some of these results were quite alarming. I began to put these patients on the liquid arginine product, and within 1 month to 6 weeks, every single one of those people, that blood test normalized. And so they are continuing to take that product in hopes that it's going to delay any development of a stroke in the future. And so far, we've been very pleased with that result. My athletes love the L-Arginine product. They perform better in competition. They recover faster from their workouts. People who have intestinal absorption problems are getting benefit from taking the balanced liquid arginine product. One of my patients, I think, summed it up best. He turns 90 this month, and he said, if you're sick, you need this balanced liquid arginine product to get well. If you're well, you need it to stay well. This is the same person, Todd, who no longer needs his nitroglycerin to control his angina since he's been taking the arginine supplement for the last 2 years. He had been taking nitro almost daily and sometimes as many as 2 or 3 at a time. I have a 76-year-old lady who was legally blind from macular degeneration who began taking the balanced liquid arginine product, and now she can see pictures on the wall, read the large print Bible, and see TV 8 feet away. I think that's amazing. So I wholeheartedly recommend the balanced liquid arginine to my patients, knowing that number 1, they're going to get their money's worth, and number 2, they're very likely to see positive results and hopefully may even save their life.
Well, thank you so much for sharing this information today. Dr. Denton, always a pleasure to have you here. Folks, thanks again for joining us on Health Discoveries, the definitive location for the latest in health breakthroughs.